Okay, what I'd like to do now is I'd like to bring some colleagues who are from an armed forces background and have a chat with them. And I've got on, hopefully we've got on the call, we've got Emma, Ian, Saul and Derek. So if you want to switch your cameras on and we'll bring down the slides deck and hopefully they've arrived. I know some of them have had some technical issues trying to join going forward. So if we bring down the slides deck and so hopefully I've got Emma,
Hiya.
Saul, Derek and Ian. And good morning, Emma. I know it says you're there, Christine, but I know you were sitting on Christine's computer. So we just thought we'd confuse the audience a little bit. Is Derek there as well? Yep. See Derek and Ian. Is Ian there? I don't know if Ian's arrived yet. And I know, Saul, you've arrived, but because you had some issues with the link, we do apologise again. You're here, the most important. Right. Let's crack on anyway. So what I'd like to do is, again, this is, I think, for our audience, I think we'd like to understand why podiatry and then how you got to become a podiatrist. I'm going to start with Emma because Emma, I think you are actually a student studying at the moment. So would you like to give us a little bit of a background on what your past career was within the armed forces and why podiatry? Why did you want to study as a podiatrist?
Yes, certainly. So I originally was in the Royal Navy as a physical training instructor. I did 13 years there. And I got to my halfway point and I've got a young family. And so the physical training side of it, I appreciate obviously the lower limbs and how they work and why we need them. So I looked outside and I was like, what can I do outside, which still has the structure of bits of the armed forces. So then there's the offer of the NHS afterwards, as long as I'm successful. There's also the private practice side. You can combine the both. And so I enjoyed the idea of the structure and also going out and being autonomous on my own. And then I looked at the financial side of it and I could use my LCAS, which those that are in the armed forces, I don't know if you're aware, if you've not got a degree already in the armed forces, then the armed forces will pay for your tuition fees. I also wasn't educationally qualified. So whilst I was in, I did my access course. So I did that alongside working. So then I'd set myself up ready to apply for university. And then I could seamlessly, as long as the university accepted me, I could transfer over and start the university course, which I'm thoroughly enjoying, and it works really well with my young family. It's Monday to Friday. Those that are in the armed forces know it can be quite, you don't know where you're going from 1 minute to the next. So it kind of worked for our lifestyle that we needed. And then it's got such a broad scope of practice. You can literally go into anything. So whether it is the wound care side, maybe the MSK, and they all kind of merge in because you need one and the other to work well, which I'm learning currently. So yeah, that's a bit about me.
Brilliant, Emma. Brilliant, and I'm pleased you talked about the LCAS and then the Learning Support Fund, because funding is always a question we get asked from everybody. How much is this going to cost and where's the money coming from? But we can talk about that a bit later. Right. I'd like to bring in now Ian. And Ian, again, where were you within your armed forces career and why podiatry?
Well, I'm going to give you a little bit of a spiel because I'm now 19 years postgraduate. So as having studied podiatry, so I specialise in musculoskeletal side of podiatry and I work in private practice. So to answer the question about the army, I did 5 years in the regular army, initially as a combat medical technician, and I worked with 19 Air Mobile, which then became 16 Air Assault. So I then became a paratrooper. I then ended up working with MedTroop when it was about 12 people. So I was the SF support medic for the last 2 years of my career in the army. But when I was looking to leave, I took a private careers interview. So I didn't use the army one. I did a private one. And after the first 2 suggestions was that if you're leaving the army, maybe you should think about the RAF or the Navy. So what I really wanted to be was a specialist. I'd done the medical side of things. I'd been winging it with various different routes for a few years. and then I wanted to be a medical specialist in something. So it offered me optician, it offered me physio, it offered me occupational therapist and podiatrist. What the hell's a podiatrist? So I thought the best thing to do was I took a placement for a day with each of those professions. And I, for example, didn't fancy being an optician, sitting in a dark room every day, just going, is that better or worse? So I liked doing the podiatry. I did some surgical, I did some routine, and then we saw sort of the breadth of practice, which meant that I could do, because it's medicine as it pertains to the lower limb, there are specialisms from wound care, as you've heard, diabetes, rheumatology, MSK, and the link between all of those, or you can be, you know, really build long-term relationships with your return patients. So I picked podiatry because I didn't have to do any more A-levels as well. That was quite handy. So I selected Huddersfield University because it was had the best rating at the time and the lowest house prices. So I could, I'd have a bed sit in Southampton, or I could go to Huddersfield and have a 3-bedroom house. So I had a study and all that kind of stuff. So I would advise that when you choose to do podiatry, not if, but when you choose to do podiatry, you see university as your phase 1 and your phase 2 training, right? You're not going to come out of the factory as a top-notch whatever. That's the start of your learning journey once you've graduated. So I took a job in my 2nd and 3rd year as an assistant practitioner, essentially kind of to get some of those bone jobs out of the way to start with, because you're going to have to, you know, earn your skills. So I was an assistant practitioner in nail surgery. I was an assistant in the MSK department, but they also had me sat in a room going through old paper records of people who died 10 years ago to try and like get rid of the backlog of the admin side of things as well. But it gave me a lot of experience and, importantly, in my case, networking. So I found during my university time that I had an aptitude for the biomechanics bit. So I thought I might go into surgery or wound care, having come from a sort of trauma background, but I found that I was particularly adept at doing the biomechanics side of things. So the application of mechanical principles to the human body to try and work out if they've got a dodgy knee and the scan says it's okay and they've done all their physio treatment, why is it still hurting? So we're there to sort of really work those sort of things out. So I've spent a career basically following my aptitude. I've got to build the job that I want. So out of uni, a bit like Emma was talking about, there's quite a lot of opportunities, even straight out of uni, if you're willing to take them. So I was headhunted to go to work for one of the companies that makes gait analysis equipment. So part of biomechanics, you might watch someone walk or run or do things like that. So there was fancy kit that allows us to do that, but they needed someone to interpret the data. So using my brilliant skills of winging it that I'd got from the army, I was put in front of orthopedic surgeons, physio departments, podiatrists, osteopaths, all sorts of different health professionals to allow them to add biomechanics and gait analysis into their thing. So everything from elite football clubs to research projects, labs at universities like Salford. In 2008, I started my own business. So I wanted to forge biomechanics in the way I thought it should be done. And when you start your own business, shockingly, no one gives you any money to do that. So I rejoined the Army Reserve. So I spent 13 years in the Army Reserve as a physical training instructor alongside growing my practice. So having my own business allowed me to go to Nepal with the Army and Cyprus and all, you know, a lot of funky stuff. But I've managed to basically build my practice. So now I've been doing that since 2008. What's that, about 17, 16 years. So now I see some elite sports people, but a lot of my patients are 90-year-olds who want to walk their dog, you know, keeping them healthy and well as possible. We liaise with lots of other types of practitioners. I lecture in biomechanics. I consult with the orthotics and manufacturers. So orthotics are little bent bits of plastic you put in your shoe to try and change the way you're walking. I managed to build a lifestyle business around what I want to do with the world. And I also even have, with the lecturer who's on here later, Jill, started a national campaign to raise awareness of certain types of foot problems that we don't, there's, so plantar fasciitis, for example, there's 40 different conditions that come under that title. So you've got to make sure you're being diagnosed with the right type of heel pain before we can attack and address that particular problem. So I hope this isn't speaking out of turn, but I'd like to offer the opportunity that I took of placement. So if you are interested in this world and you're looking for somewhere to find out what it is, you're welcome to come to my clinic. We're out in Norfolk. It's called BX Clinic. Take a look, but we'll be happy to offer you a placement and talk you through how you can transition, bring your army skills into the world of podiatry. But that's all.
Brilliant. Thank you, Ian. Appreciate, and probably come back to talk about, and that offer of experience. I know to gain work experience is something that is quite challenging within the healthcare sector at the moment, particularly with the challenges that we're facing. So I think what Ian said there is, if there's an opportunity, then I would definitely take it. All right, I'd like to bring in Saul now, and Saul is the other end. Saul is actually NHS and head of service, which is where, opportunities around leadership and as well as using your clinical skills. So Saul, do you want to give us a bit of a background on where you were within your armed forces career and where you are now, and what opportunities there are within the NHS for podiatrists?
Yes, certainly, Paul. So thank you for having me. So I left the Royal Engineers in 2008 after having my final posting with a 1 RSME training regiment. Like all military personnel, my career was spated with injuries, and that's how I really got interested in podiatry, having seen a podiatrist, having orthotics, and basically getting me back up and running and mobile again while I was in the military. So for me, that's what really got me interested in the military. And similar to Christine, I was actually supported by the Army to do my Access to Science course. That interest for me was really around the MSK side of things for getting into podiatry. However, I very quickly realised that podiatry is a bit of a ticket to the party. So I graduated out of Salford University, and when I graduated immediately, I went straight to Singapore to work as a podiatrist and spent nearly 5 years there. And I was very lucky that I got to specialise in both MSK, sports injuries, and wound care. So I had a very broad experience. I then came back into the UK to go back to the NHS, where I worked as a diabetes research podiatrist, running clinical trials and drugs trials for people with foot problems. But simultaneously, while I was doing that, I was training to do podiatric surgery, running steroid injection clinics and high-end sports injury clinics. And that for me really did solidify the variability of what podiatry offers. But during that time, I actually got a bit more of an interest in leadership and management. So I started to pursue that simultaneously. I actually left podiatry very briefly to manage a big team of nurses, 100 plus nurses. But it was the podiatry training and my experience in training that gave me that opportunity to do other things within the NHS. I've since come back to podiatry, and I'm now the professional head at Sheffield Teaching Hospitals. And we've got around 60 podiatrists here in Sheffield, ranging from a podiatric surgery team who work alongside orthopedics and vascular, to a very high-end MSK team who do ultrasound-guided injections and manage sports injuries, all the way down to vascular podiatrists, renal podiatrists, rheumatology podiatrists, and research podiatrists. So within our service, we have podiatrists specialising in multiple areas. But what's really important is we've got podiatrists who specialise across multiple areas. So you don't have to be a one-trick pony. You can do anything you want in podiatry. I think the key is just applying yourself to those areas. We have a lot of podiatrists who come from varying backgrounds, not really academic, but now they are publishing papers, writing papers and presenting at conferences. What I would say is I've had experience of private practice, I had a successful private practice. For me, the biggest draw to podiatry is the ability from an employment point of view to work for yourself, as Ian's described. You can pursue your own private practice. Equally, there is always jobs in the NHS in multiple professions and specialities, or you can go working for other people in private practice. A lot of the staff that I manage, they work both in private practice and the NHS, so they get the best of both worlds, which really does lend itself to a really diverse skill set. What I would also say is there's a lot of travelling involved in podiatry as well. We've got a lot of podiatrists who go to India to the Hansen disease leprosy colonies, going to Nepal and various other places. I think what I would say is just get exposure. My advice would be to different areas of podiatry, because there will be something that you find interesting, whether that's private practice, NHS. And just like Ian said, we're more than happy here in Sheffield to take people if they want to shadow, whether it be podiatric surgery, wounds, MSK. But we also do a lot of apprenticeships now. So my journey into podiatry was through the undergraduate route through Salford University, but we've now got several apprentices who we have taken on as podiatry assistants, who are now doing the apprenticeship with the university, and over the next 3 years will then become qualified podiatrists. So they're getting a different route into the service, but they're getting exposure across multiple areas. So they've got a bit of a golden ticket to what they want to do when they kind of graduate. Ultimately, for me, I think podiatry gives you that opportunity to be really flexible in your career and take it as far as you want. But it also allows you to diversify. My partner's a podiatrist. She joined at the same time as me. She's recently moved after 15 years of podiatry into NHS project management. So it does allow you that to diversify again later on in your career. So it's not just a one-stop shop of I'm going to be a podiatrist for 20, 30 years. It's if you want to do that, great. But if you want to then diversify and go out of podiatry for a while and then come back in, it also lends itself to that as well.
Okay, that's brilliant. Yeah. Thank you very much, Saul. I'm going to come back again a bit later. Right, I'd like to finally introduce you to Derek Santos. Now, Derek is slightly different, again, podiatrist, but he's going to talk about where his route has taken him. So, Derek, what was your armed forces career, and where are you, and what are you doing now? And I think your sign behind you is a bit of a giveaway, but we'll go with that.
Okay. Okay. Thank you so much, Paul. In terms of my journey into the profession, it was in a way of a mix between Saul and Ian. So I'm a bit of a mix between both. In terms of the forces, my experience in the forces was quite short-lived through injury. I joined about 40 years ago, which is, I was told to think about when I joined and left, and it was a long time ago. And to put things in context, when I trained with the SLR, SMG, and as I say, a webbing used to fall apart. We had to use, bungees to hold it together, and it used to get wet and things. If you're not sure what I'm talking about, you need to look back at the history books, So it was a while ago. I was born in Gibraltar, and I left school at 18. I did my O-levels and A-levels. Didn't know what to do with my life at the time, so I worked in a supermarket, and at the time I joined the TA, and I joined the Royal Gibraltar Regiment. I could have joined the air defence. They used to use a blowpipe at the time. I could have artillery 105s or infantry, and I did join the infantry, and I loved it. That was me, hooked on it. I wanted to follow a career in the military. After about a year in the TA, I went to see my recruitment officer, and I went to Limestone. I did my selection there. I went back, and did my training there. And unfortunately, my career was very short-lived. I had a fall from quite a substantial height, injured my back, and my knee took the brunt of things. And I was really in and out of hospital for quite a while. Towards the end, I had surgery in Plymouth, and I got a medical discharge through injury. I left the forces with a walking stick, and I was told I would be using that for probably the rest of my life. And in a way, that's what triggered me, to learn about health at the time. A lot of people sort of move into jobs in security, and I became a security guard at the time, and I worked in an office. I used to lock up at night, walk around, switch the radio on and read. And I started reading about my injury. There was words in anatomy that I could barely pronounce, but it was interesting. And I learned a lot about, rehab. I looked at sort of rehabilitation. I tried some other things myself, and I thought, yeah, I could do this for the rest of my life, as opposed to sitting here. And I did. So now podiatry for me, was something that happened by chance, because after doing all that, I was going to be a physio. And in those days, I went to the library, and I picked up a box for physio, And then next to it, there was another leaflet that said podiatry stroke chiropody. So I really came across podiatry, and a lot of people here and a lot of my students, you know, come across podiatry really by chance. And then they realize, oh, what's this? You know, I could do this, you know. As I read more about podiatry, I learned that, you know, it was a very challenging course. I learned that, you know, in terms of your scope of practice, you will be injecting local anesthetics. You'll be doing nail surgery, for example. You could even supply people prescribe only drugs like antibiotics. You know, as I found more about the profession, I learned that you can do things like working tissue viability, you know, working diabetes. You could even, you know, at the time, you know, look into specializing into surgery and becoming a podiatric surgeon. There was roots to rheumatology. My interest was obviously MSK biomechanics, you know, physical therapies, and definitely I could do that as well, you know. So not only could I do what I was interested in at the time, but there was also scope to move into loads of other specialties. And so I did inquire about how to become a podiatrist. And unfortunately, my 2 A levels, you know, were not science-based. So I had to then find another route. Now, my sister at the time, my sister was a GP in Scotland at the time. You know, we found there was a college and they had an access to health. Nowadays, you can get access to health everywhere. So in terms of access into podiatry, you know, college and access to health is definitely a route. So I did that. I moved over from Leeds, which when I settled, to Scotland. I went to Dunfermline to Lauder College at the time. Did my access to health. I got the GMAC trophy for that, which is like a DAX award. I then started my podiatry journey. I went to Queen Margaret University. I'm still here many years on. So I did my undergrad here in this university. By second year, as I say, my journey was slightly different because I always liked clinical, but somehow I was drawn towards research and academia. And in level 2, when I was in year 2 of my program, I was in clinic and I had a patient. We had to do a case study. We had to choose a patient, and I had a patient that had a green toenail and had an infection. So I chose that, and it was actually Pseudomonas aeruginosa. And at the time, you know, I got a good mark for that assignment, by the way. And my lecturer says you should publish that. And in those days, it says go to the library, get this journal, photocopy the authorship page, follow the guidelines, send it away, and I did. And that was my first paper when I was in year 2 of my undergrad, which was a Pseudomonas aeruginosa infection affecting the nail. It was a case study, and that was the title. So that was my first paper, and I was sucked into that. I've heard people talking about leprosy, Hansen's disease. Whilst I was in year 2, Dr. Hugh Cross, you know, had just finished his PhD and had been to India, worked in leprosy, and gave us a talk, and I was hooked into it. You know, I'm one of these people that just loves learning and will always continue. You know, every day is a learning day. You know, so I was hooked on it. So I said, well, I need to find out more about leprosy. I need to go to India. So I spoke to Hugh, and he put me in touch with Bandarawala Leprosy Hospital in Pune at the time, and also with the leprosy mission on lepra. As soon as I finished my final year exams in level 2, I was away to India, to a leprosy hospital. I spent all summer there, shadowing. The experience I got was amazing. I hadn't really seen ulcers at that point in time, but the experience I got in India was incredible. You know, I was shadowing a nurse, you know, in tissue viability. I was allowed to go into theatre and observe surgery as well, plastic surgery, orthopedic surgery. I also spent time with the orthotists. I learned in level 1. Again, Ian spoke about this, about padding and strapping and making insoles. And I could make insoles to offload these ulcers, you know, which were not healing. And unless you offload them, they're not going to heal. So I was helping out in doing these things. Came back into my level 3 undergrad. And at the time, I wanted to tell the world of my experience at the time. So I did some talks to my other students in my course. I also then presented at national level at conferences, and also international level in podiatry conferences. And also I wrote some papers on that at the time as well, once in level 3. And then I moved on to level 4. So I had big interest in tissue viability. However, my interest in musculoskeletal and orthopedics, came back. And for my dissertation, I looked at the effects of peak pressures. Again, Ian talked about computerized insoles. I can measure peak forces in the foot. They had just acquired in that time something called a PEDA that can do that. So I used that for my dissertation. I got in touch with professional football clubs in Scotland. Some said no, some said yes. So I went over and collected all this data and did my dissertation. And in fact, that paper, I published that paper, which was the effects of peak plantar foot pressures in the foot in professional footballers. And people do not know that was actually my undergrad dissertation, and that paper still gets quoted and sometimes talked about by some colleagues who teach. So I'm conscious of my time.
Derek, yeah, so I can say I'm very aware. I would like to ask some of you some other questions, if that's okay. Is that all right? So yep. Where you are based now is you are actually based within the university environment as an academia. So I think yep. what we've shown here is we've got examples of Emma, who is obviously undertaking her studies, and he's on that journey. And hopefully, Emma, you've learned from 3 people there. There are big opportunities for you. And we've then learned with Ian and the route that he took, very much within the private practice sector. And then we've got Sol, who's very much driven by the leadership and it's NHS. And then obviously we've got Derek within the academia environment. Emma, I'd like to ask you a question. What is it like studying now? And I'm going to use this term, and please, I'm just not just as a mature student. Because I think we all get this concept of university in our heads, that university is for young people, but we know it's not. So do you want to just say what it's like to be a student who's all from a career changer perspective?
Yeah, so on our course, I am not the oldest, and most people are of my age, to be fair. We've got 2 people who I'd say have come straight through the educational system, and everyone else is classed as a mature student. And it's good because also with this course, it's practical as well as theory based, and they both kind of run concurrently alongside each other. So if you're more of an academic person, then it tickles those fancies. If you're more of a practical person, it also tickles them and brings them both together quite nicely. So it's very appertaining for both aspects.
So from your perspective, you don't feel out of your depth. You're very much among a cohort of individuals who like you from that perspective. Was there any concerns and worries then before you went off that you were going into an environment that was going to be completely alien to you?
Yes, there was a slight concern that I was going to be like the oldest and everyone's going to be 19, 20. But I actually had a conversation with one of my colleagues who is she's 20. And I was like, how does it feel? Did you expect everyone to be young? Because it's kind of flipped on its head, if that makes sense. She's one of the youngest here, and she's not got many people on this course who are of the same age as her, but we all kind of gel along. I don't know if it's my background, because you work with all ages. When I was in the military, it doesn't matter how old you were, you just, as long as you could do your job and you got on with each other, then you can apply those principles. And it's quite nice to have a mixed background and a mixed age group of people. It makes it interesting.
Okay, Ian, do you take students then as part of within your sector to support them educationally?
Yeah, we tend to have them on sort of work placements and things like that. So everything this year, we've had some 15-year-olds sort of looking at careers in healthcare. And last week I had a colleague who's been practicing for about 20 years here on a placement. So just shadowing sort of thing. So I mutually mentor a guy down in London because we run sort of parallel practices. So we sort of help each other out there. So there's lots of different routes that we do that. I will say on the academic side of things, I'm really quite severely dyslexic, have the reading speed of an 11-year-old. Handwriting that's very well suited for a medical profession. And there's loads of support for getting there. You don't have to get the top grade. No one's ever asked me really what grade I got at university. They just want to know if I can do the job. So, you know, don't let the academic side of it put you off if that's not been your strong point, because, you know, for a lot of us, I remember when I was in the army, that was why we were in there.
And I know we've got some individuals from the universities who are going to come in later. It might be worth, I don't know if you're able to put within the chat, how you would support individuals like Ian, because I know there is the reasonable adjustment policy within the NHS, which should support individuals like Ian, who is dyslexic. And I know from individuals I know who've gone into the university environment, universities are able to support from that. So again, that's another thing which is quite important. There is no reason why you can't do it at the end of the day. It's just more about how you navigate that. So from your perspective then, do you take students on placement with you in Sheffield? And where do you take them from, and what years, etc., etc.?
So we predominantly take university students, undergraduates, in their first, second and third years. And that often leads to a job for them afterwards, should they choose to work for us. And we usually have them for block placements, anything from 4 weeks up to 3 months. And we have them from all over the country, from Southampton all the way from Huddersfield. And some of those students actually stay in Sheffield for that period of 3 months while they're doing their placement. So they get to sort of culturally integrate with the staff and the local area, which is quite nice. We also take students from the local schools in their, I think it's year 15, so age 15, who are doing placements just as an interest, just for a couple of days, just to see. So, but we also do a lot of staff from other areas around the NHS who come to shadow, whether it be our specialist diabetic foot teams. We get a lot of people shadowing the research element, but also a lot for the MSK as well. So it really is very varied. And some of those people who come have been in practice for years and years. They just want a refresher to see how things are done. Others are just starting off on their journey and want to know what it's like to specialise in a different area. So they come and spend a bit of time with us as well. And just back to the point around what Ian said around dyslexia. So I joined the military initially because I failed academically at every facet of my young age. And when I was in the military, I was told not to mention that I had dyslexia because it would impact me in my progression. But when I went to university, they were very supportive and gave me strategies to combat my dyslexia, which then resulted in me going on to research and doing my own publications down the line, which I would have never thought possible when I was in the army. So what I would say is there's a lot of, if you're willing to embrace the support that's out there, then anything really is possible.
And Derek, then from your perspective, and you're very much in the academia environment, I think it shows, and we talk about this within the health environment, there's the 4 pillars, isn't there? There's the clinical side, there is the leadership side, there is the academia side, but there's also the research side. So whatever your flair is, there is an opportunity to follow that within whatever your career is. And I think the examples we've given. So would you say, from your point of view, it's about getting the mileage as being a podiatrist, but also be aware, and I think this is quite common nowadays, the 4 pillars is started from day one?
Absolutely, I totally agree. I think obviously, you know, we do follow different pathways. The good thing about podiatry, when I looked into it, you know, is that it does give you that opportunity to choose a path, you know, whether it's a clinical path into a particular specialty, whether it's research and academia or even leadership, you know, it does give you those opportunities. It does allow you as well to sometimes, you know, move from one path to the other, or take 2 different paths at the same time. So in terms of opportunities, it's a career that you can make what you want, really, you know, in terms of work. It's every day is different, and I think people join the armed forces because of that. Every day is a challenge and every day is different. And podiatry, I would say that every day is a challenge and every day is different. If you're clinical, you do not know, you know, what your patient is coming from, and you need to work out what the issues are and how to treatment. If you're doing research, it's the same. It's about learning, and if you're in academia, it's about teaching. So every day is different. Every day is a challenge. So yeah. Mm-hmm.
And I think from sort of the messages that I've heard from you is that every day is different, and I'll agree within healthcare every day is different, and particularly with the challenges we're facing at the moment. From where you saw yourself when you first started, and I'm going to each individual, to where you are now, what sort of challenges did you face on the way? And I know, Ian, you've talked about your dyslexia as a challenge, but what other challenges have you faced throughout your career, and what transferable skills do you think you brought from your armed forces career that helped you to meet those challenges? Do you want to start, Saul, first? So I throw you in the deep end on that one.
Yeah, certainly. So I think military personnel are extremely well placed for a lifestyle in healthcare, because they're extremely flexible and adaptable. And the healthcare landscape changes from one minute to the next, whether that be different clinical practice, different pressures on the population. So the military are very, very good at flexing and adapting to the situation in front of them. And if they bring that principle through into their sort of into a podiatry career, then that will bear them in good stead. And what I mean by that is just like no day is the same. You know, we're going into winter pressures at the moment in the NHS, so things will change and shift to support the main acute hospitals. So my team will have to shift and adapt to make sure people don't go into hospital as much. So we flex and adapt in that way. So I think for me, that is one of their biggest strengths, that they can generally put their hand to anything, they can apply themselves, they can knuckle down, and they can get through it. So for me, I think they're very well placed for careers in healthcare. The biggest challenge that I faced when I left anything, going from the military to Civvy Street, was that transition from being in the military to being a civilian. As in the military, I have a certain standard. I expect X, Y, and Z. I expect others to do their best. I expect others to deliver. And actually, that's not what actually happens in general civilian life. So for me, the biggest transition was just to observe and reintegrate back into that civilian life from the military. I have a brother who's done 30 odd years in the military, and he cannot reintegrate back into civilian life. He is struggling. So what I would just say is, for anyone who's particularly going into university, it is a different world. Just be mindful of where you've come and where you're going. And I think that was my biggest challenge.
Yeah, and it's quite interesting what you just said there. So that comes out quite a bit in some of the other insight days we've done, is where people from an armed forces background moving into the university environment. And Emma, have you noticed that you've moved from one area into another area, and it's a bit of this is interesting?
Yes, it is. So like you've got, like you were saying before, there's expectations in the military and standards that you have to keep, and you hold yourself to, and then you come into civilian life and university life, and it is a shock, but you can still hold yourself to them standards if you so wish. If you want them not to be held so high and have an easier way, you can also do that. But obviously, like the time management and deadline management and all of that stuff can be brought over from the military life. And then your life is so much easier because you've already got those instilled within you, and you just let other people crack on how they are. Sometimes you have to soften your skills a bit, socializing and whatnot, but that's absolutely fine as well. And it makes the world that we're in today.
Ian, from your perspective, and I think that the thing is, we must be aware we do have standards within healthcare, and those, but they're sometimes they're slightly different standards and the way in which people portray them. But I understand where you're coming from. The military certainly has standards, and sometimes moving to different standards can be a bit of a challenge. Ian, what about you from your perspective? Because I'm sure you've seen that in the variety of environments that you've worked.
I think I could reiterate all the things that have been said already, but I'd probably say to take two concrete things which the Army has sort of instilled or given. One of them is the ability to create an ethos. So certainly within my own practice and for my staff, we use probably military principles to a degree in terms of setting an ethos. And we have a service test essentially, which is every decision is for the patient's benefit. And as long as my staff use that as the baseline of their decision making, they will get backed by management and the support structures. The other side of it is the ability to have sort of a formulated planning process. So obviously there is as an NCO or an officer, you'll have gone through various different planning processes. And when running a business, you've got to be the clinician, you've got to do the marketing, you've got to manage the building, you've got to manage the contracts and solicitors and things you've got to work with. You've got to provide education both for yourself to make sure you're up to date and your staff. So the ability to lay that out in a planning process and make sure you're filling in all the different bits on the way, the in order tos, and that kind of stuff. So 1 up, 2 up intent, knowing those kind of things. It's obviously you might use a different language, but those skills are definitely coming into, I'm sure Saul's used them in the management area as well, but I've certainly used them in the business planning process, which you've got to sink or swim. It's your baby.
Yeah. Well, it is when it's a business, yes, but I think the same applies within the NHS. We're there for our patients, and I think that ultimately is coming across from what we're hearing about today. You know, the work that Derek's done around the research, etc., that is patient for the patient at the end of the day. Ian, you serve a patient population and you're able to provide that through your business. So you obviously provide that within the NHS. We're there for patients, and I'm sure the throughput and the volume can be overwhelming at times. How do we manage that then as clinicians when we're being put under so much pressure? What skills have you brought from your world of the armed forces? And I'll go to Derek first on that one.
Okay, so coming from an academic sort of background, and I think I'll talk about the academic, you're coming into education, and it is a big change, in terms of learning. You're coming into this environment. Now, one of the good things about being in the military is you bring life skills and you bring determination and you bring skills that will help you definitely navigate your way through the. Obviously, you need to be organized, your organizational skills in terms of, you have to give yourself targets in terms of reading, in terms of learning, in terms of meeting targets for assignments, in terms of preparing for exams. So I would say from an academic perspective, you're bringing in a lot of skills that will really help you navigate your way through the education system.
Okay. So again, there is that transferability. So Sol, the same for you then. The NHS is under a tremendous amount of pressure, and I know podiatry services within the NHS are under extreme pressure and the challenges.
It is, and it's more than ever now. We invest in our principal asset, which is our podiatrists, our staff. So we invest heavily with them, both from a well-being point of view, around making sure that they have got doable jobs, they're not overwhelmed. Also about their future and their training. So we make sure they've all got well-defined training plans, and they're on a career that suits them and they're happy with. Because one thing we have learned, that if we don't listen to what the staff want, then they'll quickly move on. So we invest heavily in the individual staff, whatever it is that they want, and within our gift, then we will support. It's also around about trust as well. By the time they graduate, they are autonomous diagnostic clinicians. They know their stuff. We put checks and balances in place around training, governance and audit, but it relies heavily on trust and autonomy within boundaries. And we often find that the more autonomy our podiatrists have to go away and do service evaluation, they see a gap in patient care and they say, we can do better. I want to go and do X, Y, and Z. And we let them run with it. We give them that responsibility. We often find that really increases job satisfaction. I've just got a podiatrist now who saw a gap in an area that we could do better. We've let him run with it. We've now got these specialist clinics around F-scan, a pressure measurement system, and he's now running that clinic. And that we didn't have that before. He saw that gap and wanted to run with it. So we just try and invest heavily in the individual, give them as much autonomy as we can, and we build it around that culture of trust and mutual support. And ultimately, we just try and we've got 60 odd in our team, and we just try and be that one big team across the whole organisation. So we're very small. There's 19,000 staff nearly in our organisation. So they make a very small part of it. So we just try and make sure that they've got that culture of support, trust, and that seems to be where our strength lies in such a small profession.
And Ian, sort of off of that then, so I suppose one of the challenges of running a business is obviously the business needs to create income, but also we need to make sure that the people who are providing the care, the podiatrists, are kept up to date. So what sort of support and mechanisms are in place within your environment to ensure that you've got highly skilled clinicians delivering the care that your business requires?
Again, I think it's going back to the ethos word. It's patient driven, not profits driven. So you're not going to be a millionaire by being a podiatrist. I think I only know one millionaire podiatrist, and he did it by owning property, not by being a podiatrist. But it's by being patient driven. We've got perhaps longer appointment times than you'd have available in the NHS. So the staff can build the type of relationship with that patient that they get a good therapeutic outcome. I've certainly done counselling courses and various things like that, so I know how to ask the right questions to understand why the patient is here and why they might not have sought other routes, working with other health professionals, referring into disciplinary referrals, things like that. They're all very good. I think we do mainly conference-based education pathways, so people get to, if they want to have a specialism or an interest in something, then we would send them on either a training course or to a conference that's relating to that. I think I probably go to, between speaking at and attending, about 6 or 7 conferences a year as a private practitioner. So that's traveling around the country, staying in hotels and either attending or lecturing at conferences. And that all counts as your continuing professional development, keeping yourself up to date. There's nothing like having to deliver a lecture on something to make sure that you're spot on with where it needs to be.
Okay, that's really helpful. Emma, so did you say you're a second year student? Is that correct?
Yes, I am indeed.
I want to know about your placements then. So what have you had the opportunity to experience so far? So during your studies, you will be learning as much as possible about the world of podiatry, but as they say, you probably don't start to learn until you're qualified. And I don't know if my other colleagues on the call would agree with me with that. So what have you done so far? What have you undertaken during your studies?
So this year so far, second year, we started with a 4-week placement in the NHS. So I was at the local trust here, and it's county-wide, the trust. So we did everything from wound care clinics to MSK, surgery, and we basically shadowed to begin with the practitioner, and then we had our own clinics under the watchful eye of the podiatrist, where we did the general care as well. So we got a wide variety. Last year was slightly different. In our first year, we had Leaf Hospital. So we were, every week we were in there for a day and a half, seeing patients who were coming in. So you get both sort of sides of it, depending on which university that you choose to go to, depends on what they have access to. But moving forward, I've got another NHS one coming up for 4 weeks. And then next year, we've got the diverse one is in next year, not next academic year. And then you can go into the leadership side if you want to, educational side. And then that's hitting all those pillars. You can also go into, private practices as well and see how that they run and whatnot. So you get a really wide variety. So you're not just channeled down into one sort of aspect of it. You get a right breadth of knowledge and experience from everyone.
And what's your plan once you qualify then? Where do you see yourself to start with? I'm not going to say in like 5 years or 10 years. I don't like that question because none of us really know. So where would you like, when you qualify, what is your plan when you qualify?
So ideally, if all my stars align, I pass, and then I would like to get half NHS experience and half private, and be exposed to both, depending on what jobs are available out there. And because I think the NHS offers you a lot of CPD and experience and fast pace, and almost sort of like the military side of it. There's the structure as well, and you can work towards stuff. And then the private stuff, if you get different types of clientele that come in and different pathologies and all of that sort of stuff. So hopefully if I can do side by side, even if it's 1 day a week private, 5 days a week NHS, or half and half, see what's available at the time.
Okay, that's great. And I think from my perspective as, say, physio, I've worked alongside podiatrists in the NHS for a number of years, and you know, it's that collaborative working, which I think also is important sometimes. And as I said at the very beginning, you know, if you liken the AHPs, we work together at times. There's a lot of collaboration, a lot of working, and I'm sure even within the private sector with Ian, you collaborate with other AHPs, other healthcare professionals from that perspective. What we've got about 4 or 5 minutes left, so let's just, what I'd like to do now is, what is, and this is the question to all of you, what is the one thing that surprised you about podiatry when you came into it, or now? What is the one thing that's really surprised you about podiatry? Let's start off with Derek. So what is the one thing that surprised you about podiatry?
I think it was the diversity of opportunities, you know, available, and it wasn't until I qualified as an undergrad student, you know, with my degree, BSc degree, that I just realized, you know, that there were so many different directions I could take, you know, from, as I say, I chose a particular direction, but you know, I was thinking at one point of tissue viability, going into diabetes, you know, obviously you need to start at the beginning, you know, you start as a podiatrist, you know, and then you can look at specializing. But yes, you know, during that sort of interim period, you know, it was just so many things, you know. It was a little bit initially, you know, I wasn't sure, you know, which direction to take, you know, at that point in time, and hence, you know, spending a few years, you know, working as a podiatrist and getting some experience as a podiatrist, or we could say a general podiatrist, is very important, because that will help you then decide which direction you want to go. But yes, you know, I would say it was more really, you know, the opportunities that you have is just amazing.
Okay. Mm-hmm. Ian, what about you? What's the one thing that surprised you about podiatry?
Well, Derek's nicked it, so I'm going to. So the diversity of opportunities is the surprising thing. No one's ever heard of podiatry before, and then when you scratch the surface, it's got everything in it. I'd probably say, if I was to go for the next most surprising thing, is the ability to create diverse networks of people that you're working with, colleagues from different professions, learning from each other, growing your practice, growing your knowledge, and growing your confidence within that sort of supportive and competitive world. So, you know, again, I think those military skills of, you know, working your way up the chain of command, so to speak, but in terms of putting time in and growing things, but that ability to network, still have camaraderie, and build those connections.
And you, Sol, what's the one thing that surprised you?
Yeah, it's getting hard now, thanks to Derek. He stole the main one. So I think for me, podiatry is very much a gatekeeper profession, very much in the NHS, and you don't realise until you become a podiatrist how integral you are to other healthcare professions. So, for example, now I do a lot of work with the nursing teams around tissue viability, vascular, and the community nursing. Now, I wouldn't have thought a podiatrist would have any place in that world, but you actually sit very high in their world, and you help guide their clinical practice and their treatment. The same is with the medics who are diabetologists and endocrinologists. You know, we are at the seat at the table with them as a partner. We're not subservient. So you sit there, and they really, really value your input, your skills, your knowledge, and they often come to you for that. The same is with physios and orthopedics in the foot and ankle pathways. You sit at the table with them and discuss it. You're not subservient. So I think for me, what was so surprising is the fact that when you become a podiatrist, you get those skills. You are invited to sit at the table and be very broad around the strategic direction of clinical care for the population. And I think that's there's not many professions that get a seat at the table so broadly in so many different areas. Whereas I can be with nursing in the morning, orthopedics in the afternoon, vascular in the afternoon again. So I think for me, that opportunity for you to really get out there and explore the healthcare landscape and world and be involved as much as you want to be is quite a precious thing that very few professions get.
And what you just said there, sorry, go on. Yeah, go on.
Point a little bit. I've had many practitioners in as patients who are GPs and other types of professionals. And when it's kind of a bit of an undervalued profession. I think feet aren't sexy, you know, and obviously feet are not all we do. They're at the end of what we do. But when clinicians actually start to understand what you do, what the scope is, the amount of times people had doctors say, you've got a lovely little niche here. And, you know, they're envious of the ability to form those relationships with their patients, see them through to actual genuine outcomes, life-changing outcomes for those patients, back doing the things that they love doing. So, you know, all the injuries that people have mentioned that stopped them in the army, and I was lucky not to get that kind of thing. But, you know, I can't think of how many people dropped out of my P company because of knee pain. And I could probably have helped about 90% of them get to the end of that P company if they'd have had the type of intervention that I do now. And other professions aren't as aware of it as we'd like them to be. So Saul's seat at the table is really helping us change that as well.
And finally, Emma, because you're on that journey, what's the one thing that surprised you about podiatry, but more importantly, about having to study podiatry?
There's something for everyone. In the fact that if you think, oh, you're just going in to do feet, you learn about so much more and how everything connects and how you do need to use your skills of talking to people, active and listening and all of that sort of stuff, and everything that you're taught from the military side. And I never realised how transferable all those skills are. You think you do a 4-week or a 6-week leadership course, like later on in life, that pays dividends, and you can bring all of that to the table of podiatry, and there is literally something for everyone.
Brilliant.
I just jump on that a second.
Yeah, go on.
The organisation I work before actually sends their NHS leaders to the military for their leadership training. So, you know, you've got an abundance to offer because it's working the other way as well, you know.
Definitely. Right. Well, hopefully those listening have found out that it is possible to move from an armed forces career into the world of podiatry. And what we've got in front of us is a wealth of experience and knowledge that's been developed over those years. We've got Emma, who is just on that career journey, but is bringing so much from her former armed forces career. We've got Derek, who's up in Scotland, exploring and expanding the academic world of podiatry, which is so important. We've got Ian and the way in which he's taken his business forward and showing that from an armed forces career you can develop from that point of view. And then we've got Saul here, who is driving forward podiatry services within the NHS. I'd like to say a big thank you to all of you. I know some of you are busy and have got to go off and do other things and, you know, earn the monies, etc., study, whatever it be. But again, thank you very much for your time. We do appreciate it, and take care. Thank you.